February is American Heart Month. Now, to help celebrate, Bristol Hospital is hosting a free educational seminar regarding preventing and treating heart disease. And here specifically to talk about heart failure, I'm happy to have on the show Dr. Fawad Kazi. He's the section chief of cardiology for the Bristol Hospital Multi-Specialty Group. And a pleasure to meet you, Doctor.
Tim, thank you for this opportunity.
Yes.
Thank you for having me.
Glad to have you here. Question one, first and foremost, and I need to know this too. What is the difference between heart failure and, say, a classic heart attack or other heart problems?
A heart attack is more of an acute event. It is a catastrophic acute event that no one should encounter. Heart failure is more of a chronic medical condition, a very common one that is prevalent in our community. And it is important for us to learn about it so we can empower ourselves ways to prevent it and treat it effectively.
It sounds just like something that causes instant death. You need your heart to work. If it's failed, okay, what are you going to do? Right. Well, what specifically is the mechanism behind heart failure?
Sure. Heart failure basically is the inability of the heart to provide blood to the organs and tissues of the body. There are two separate types of equally common heart failures. If you imagine my fist as the heart pumping chamber, the commonest type of heart failure is the weakness in the heart muscle in squeezing and pushing the blood forward to the body. The other type is a stiff heart muscle, which is not adequately able to fill with blood. The net result is, by either of these mechanisms, the heart's not able to provide the blood to the body in an effective manner. And as a result, the patient develops symptoms and a detriment in the quality of the life. It is a very common condition. Almost 6 million Americans are currently living with heart failure. And it is the #1 cause of patients being hospitalized 65 years and older in our hospitals. So that puts a significant drain on patients, their quality of life, as well as on our healthcare system. The causes of heart failure are many, but the #1 cause of heart failure is coronary artery disease, which is blockages or tightness in the blood vessels that supply blood to the heart itself. What
can we do about it when people are diagnosed? To what degree is it reversible or at least treatable?
Certainly. It depends upon the stage at which the diagnosis is made. The most important thing is awareness, really learning with the help of the doctors, the healthcare providers, and the information that is available. Depending upon the cause of the heart failure, strategies could be undertaken to treat the heart failure. Things can be done at the preventative stage, where patients can simply do simple things like doing sodium restriction in their diets. Sodium as a molecule is a magnet for water. It causes water to be trapped inside of the body. In heart failure, as you remember, I said the heart is having difficulty in pushing the blood forward, so all that blood gets trapped and gets congested in the body. And sodium augments that problem by trapping more water. So if they can restrict their diet to 2,000 milligrams of sodium or less in a daily manner, then they can prevent water retention. Further, they can also start to weigh themselves, because one of the earliest signs of exacerbation of heart failure is water retention and weight gain.
There you go. And now, if you are diagnosed with heart failure, of course, you don't need to hear anything from me. You need to go see specialists like Dr. Kazi. But that's good. Just something to try to keep an eye on in case you're worried about your risk failures for heart failure. And again, Bristol Hospital is hosting some free educational seminars to help you out with that, so you can get in touch with Bristol Hospital for more on that. Dr. Kazi, I know we're just starting to touch on the topic. I should probably come down there and do more stories with you sometime in the future, but I'm glad you were able to join us here tonight.
Thank you very much for this opportunity.
I said tonight. Yeah, sorry. This morning at 9 o'clock. Again, Dr. Kazi, thank you so much.
Thanks so much.